Hello, my friends. I'm Dr. Linda Parker, urologist, senior health specialist, and most importantly, an advocate for truth in medicine. Today, I want to have one of the most important and potentially life-saving conversations with you. Pause, gentle tone. It's about something most people never question. Medical tests. The same routine screenings, blood draws, and scans that doctors automatically order for seniors over 70. But that can sometimes cause more harm than good. I believe it's time we talk honestly about this. Because when you're over 70, healthcare should no longer be about more tests, more procedures, more pills. It should be about living better, not just longer. You deserve to understand which medical tests actually help, and which ones create unnecessary anxiety, false diagnoses, and even dangerous overtreatment. When you understand this distinction, you don't just protect your health. You reclaim your power. Welcome back to this space where patient advocacy supersedes protocol, where informed decision-making replaces blind compliance. Because, my friend, after 25 years in geriatric urology, I've learned one painful truth. The healthcare system doesn't always tell seniors the whole story. There are 5 medical tests routinely ordered for people over 70. Tests that doctors perform almost automatically. But that evidence shows often harm more seniors than they help. And yet, more than 90% of physicians never explain the true risk versus benefit to their elderly patients. So today, we're pulling back the curtain. By the end of this talk, you'll know exactly which test to question, what the medical evidence really says, and how to protect yourself or your loved one from unnecessary medical harm. Because the truth is, what saves a 50-year-old life can ruin a 75-year-old's quality of life. Let's begin. The medical reality. No one tells seniors medical testing after age 70 requires a completely different risk-benefit analysis than testing younger adults. What might be life-saving at 50 can be life-threatening at 75, but our system rarely adjusts for age, frailty, or life expectancy. Instead, many doctors follow the same rigid checklists, the same electronic prompts, and the same fear-driven protocols, without asking the most important question of all. Will this test actually improve this person's quality of life? You see, one-size-fits-all testing doesn't work in geriatric medicine. A healthy 72-year-old marathon walker is not the same as a frail 72-year-old with heart disease and low mobility. Yet the testing protocol treats them identically. And that's where the harm begins. So, which tests are being over-ordered for seniors, and why are they potentially dangerous? Let's go through them carefully, one by one. 1. PSA screening. After age 75, the silent trap for older men. This one breaks my heart, because I've seen it destroy dignity, confidence, and even lives. The PSA blood test for prostate cancer is one of the most overused medical tests in elderly men. The U.S. Preventive Services Task Force, one of the most respected medical bodies, explicitly recommends against PSA screening in men over 70. Why? Because the harms outweigh any potential benefits. Here's the reality most men never hear. Prostate cancer in men over 70 is usually so slow-growing that it will never cause harm during their lifetime. You are far more likely to die with prostate cancer than from it. But once you take that PSA test, the cascade begins. A slightly high number triggers a biopsy. The biopsy causes infections, bleeding, and pain. Then come aggressive treatments, surgery, radiation, which can leave a man permanently incontinent or impotent, all to treat a cancer that, in most cases, would never have affected his remaining years. A massive JAMA study of over 76,000 men confirmed it. PSA screening in men over 70 showed zero mortality benefit, but caused significant harm through overdiagnosis and overtreatment. You risk your independence, your quality of life, and sometimes your very will to live, for no measurable survival gain. So the next time a doctor says, "Let's just check your PSA," ask this instead. Given my age and my health, am I more likely to die with prostate cancer or from it? What are the specific harms of the biopsy and treatments you're recommending? Because once you ask those questions, you're no longer a passive patient. You're an informed one. 2. Colonoscopy. After age 75, the risk that hides behind routine. Colonoscopy has saved countless lives when done at the right age, but after 75, that balance begins to shift dramatically. For younger adults, colonoscopies can catch and remove dangerous polyps before they turn cancerous. But in elderly patients, especially those who've already had normal results in the past, the risks often outweigh the benefits. Why? Because the colon becomes more fragile with age. The sedation used during the procedure becomes riskier, and complications like bleeding, perforation, or infection skyrocket after age 75. In fact, studies show the complication rate triples in seniors compared to middle-aged adults. Gentle emphasis. The American College of Physicians now advises against routine colonoscopy screening for average-risk adults over 75 who've had normal prior exams. If you've had 2 clean colonoscopies before, your odds of developing a life-threatening colon cancer that affects your lifespan are very low, while the odds of harm from the procedure are high. So if your doctor recommends another one, ask, given my previous normal tests, what's my actual risk now? What are the chances of serious complications at my age? Are there safer alternatives like stool-based tests? Because sometimes, the most powerful thing you can do for your health is say no to what's unnecessary. 3. Mammography. After age 75. When detection becomes distress. For decades, women were told early detection saves lives, and for many, that's true. But after 75, the picture changes dramatically. Routine mammograms in older women detect cancers, but many of them are slow-growing and non-lethal. Treating them does not extend life, but it does add suffering. A JAMA internal medicine study found that mammography after age 75 led to no improvement in survival, yet increased harm from unnecessary surgeries, radiation, and chemotherapy. The emotional toll is also real. The fear of false positives, the endless follow-up tests, the scars both physical and emotional. And what's often ignored is context. If a woman's overall health and life expectancy are limited, then finding a slow cancer that would take 15 years to matter offers no real benefit. So if you're over 75 or caring for an elderly loved one, ask, would treating a cancer found now truly extend life or just reduce its quality? What does the evidence say for women my age and health condition? Because medicine should care about how you live, not just what it finds. 4. Diabetes over management. When good control becomes dangerous, here's one of the most common and misunderstood dangers in elderly care: overtreating diabetes. For years, doctors drilled the idea that lower blood sugar is always better. But in frail seniors, that's not true, and it can be lethal. When blood sugar levels are pushed too low through aggressive medications, it can trigger hypoglycemia, sudden drops that cause confusion, fainting, falls, and even death. Multiple studies show that tight glucose control, A1C under 7.0, in older, frail patients increases mortality. That's why the American Diabetes Association now recommends relaxed targets for seniors. For many, an A1C of 7.5 to 8.5 is safer, wiser, and healthier. But many doctors still push the same targets used for middle-aged adults, not realizing they're putting their older patients at risk. So if you're managing diabetes after 70, ask your doctor, what's the safest glucose range for my age and body? Could looser control actually protect me from dangerous lows? Because the goal after 70 isn't to have perfect lab numbers, it's to stay steady, strong, and safe. 5. The overuse of imaging, scans that find trouble. You don't need CT scans, MRIs, PET scans. They sound reassuring, don't they? Like we're checking everything. But in elderly patients, these tests often create chaos instead of clarity. Here's why. Advanced imaging almost always finds something. Tiny nodules, cysts, shadows, calcifications, most of which are harmless. But once a doctor finds them, they can't unsee them. They order more tests, more biopsies, sometimes even surgery. And that's how a simple scan turns into a spiral of harm. A study in JAMA Internal Medicine found that incidental findings in elderly patients led to unnecessary follow-up procedures in 23% of cases, with zero improvement in survival outcomes. Imagine that, almost 1 in 4 patients hurt, none helped. So before you agree to a routine scan, ask, what specific concern are we looking for? If we find something, will it actually change my treatment or lifespan? What are the risks of unnecessary findings? Because sometimes the peace of not knowing is safer than the pain of unnecessary intervention.